The hours and days after giving birth can be an exciting, overwhelming, and emotional time. Your body is in recovery from either a vaginal birth or a major abdominal surgery, and you have a brand new baby to get to know and care for. In a clinical or hospital setting, there will be nurses, midwives, and doctors checking on you and your child to ensure everyone is happy and healthy before you go home. Though some of their questions may feel bothersome, it is important for catching problems early on before they become dangerous. Everyone's postpartum experience is different, and your nurse may not perform the exam in the same order shown here, and may not ask the same questions, but they will make sure to check all the systems necessary to send you home happy and healthy.
Yeah,
Hi, how are you doing, Audrey?
I'm okay.
My name is Maria, and this is my student nurse. My name is Naya. We're going to be assessing you today. How was your night?
It was okay. I had to get up a couple times to feed baby here, but so I'm kind of tired, but everything else is okay.
Yeah, that's totally normal. Being tired after a long labor happens. For part of our assessment, I do want to start with the breastfeeding. How is that doing?
It's been pretty good. She's latched on to feed for like 15 to 20 minutes, but I'm kind of sore on my left side, but it's pretty tolerable.
Okay. So next time you feed, can you call us in so we can just assess the latch and see if everything's going okay? I'll also assess for any bruising and assess the level of tenderness. And if we need to, we can get the lactation nurse here to give us a little extra help. Does that sound okay?
Yeah, I can do that.
All right, perfect. It shouldn't take too long. Would you like your partner to stay in the room with you?
You want to stay?
Yes, of course.
Okay.
All right. So I'm going to start by checking your uterus. After delivery, your uterus should be clamping down, becoming firm, and returning to its pre-pregnancy state. I'm just going to press down on your uterus here to feel it, and this can sometimes cause some discomfort. And are you having any pain right now?
No, it's like a 1. The night nurse asked if I wanted any meds, but I think I'm okay. I don't want any now.
Okay. All right, let me know if you feel any pain, okay? Any pain? All right, your uterus does feel like it is deviated to the right. When was the last time you went to the bathroom?
I'm not sure. Probably sometime last night.
Okay, so we should get you up to go to the bathroom because that might fix the issue.
Okay.
Before we do that, I want to make sure that your vitals are good, so I'm going to have my student nurse, Naya, do those vitals for you. Is that okay?
Yeah, okay.
All right, perfect. How are the vitals?
They were all good.
All right, awesome. Yeah, we're just concerned with blood loss. Sometimes you can become hypotensive, which means you just a little bit dizzy. So we're going to do this in steps. That way we make sure that you're able to walk to the bathroom on your own. I know you didn't have an epidural, so that means it's going to be a quicker process getting you up usually. But I'm going to have you sit on the side of the bed. That way we can do another set of vitals, and then we'll walk over. Okay?
All right, I took vitals again. She's not orthostatic, temp, blood pressure, everything is good. I think we can get her up to the bathroom.
Lovely. And just to double check, no excessive bleeding, right?
No, I had to change my pad last night, but it wasn't too bad.
Okay, that's amazing.
You having any pain right now?
No,
No dizziness?
not really. I'm feeling fine.
Okay. Here, can bring that in here. There's a peri bottle that rinse your lower area, and you can blot lightly with toilet paper instead of wiping heavy. And you can also use the dermaplast, which is that numbing spray that can kind of help to alleviate some of that discomfort.
I don't really need to yet, but I'm kind of scared to poop, especially after delivery. Do you think it's gonna hurt? Or what can I do to make it feel better?
That's a totally normal feeling. You are not alone, I promise. So we're just going to make sure that you're drinking plenty of water and ambulating when you can. We also have an order for Miralax, which is a stool softener. That'll make things a little bit easier. And then if anything else, we have witch hazel pads and Tux pads to help as well. I will look at your pad if that's okay.
Yeah, I'm all done.
How much bleeding is normal after having a baby?
That's a great question. We want the bleeding to be light to moderate, and basically saturating a pad any more than 2 hours is a little concerning, and we want you to keep an eye out for clots that are larger than a plum and any foul-smelling lochia. Fortunately, her bleeding was just totally fine, so there's nothing to worry about.
Okay, thank you.
All right, now that you've used the restroom, I'm going to reassess your uterus. Does that sound okay?
Yeah.
All right. Again, let me know if there's any pain. All right, we still feel a bit soft. So, Naya, what would we call that?
We would call that a boggy uterus, and usually what we do to help make it contract and firm up is give it a massage, and it helps prevent excessive bleeding. Yeah, usually you could feel a little discomfort, but it's important that it becomes firm.
All right, so we'll do a massage here. Does feel like it's firming up. That's a really good sign. Okay. We're going to assess your laceration now. I know you had a 2nd-degree tear. How is that feeling?
It's a little uncomfortable and it kind of stings when I pee too.
Okay. So I'm just going to have you turn to one side and I'm going to assess it, okay? And then cover you. All right. So your laceration looks good. No redness or discoloration. No swelling, no discharge, and your stitches look really good as well.
Okay.
It should continue to heal, but if you notice any changes, let me know. I noticed a small couple hemorrhoids as well, so that can be helped by the Tux pads that we talked about, and we can just roll you back to this side.
Okay, yeah.
Your exam looks amazing. I'm really glad that you're doing so well. I know we kind of covered this at the beginning, but how are you feeling with everything?
Yeah, I think we're both definitely just a little nervous to take our baby home, but I think we have the nursery set up and partner's been really good about reading all these different parenting books, so pretty excited and hopeful, and my friends have been cooking, so I don't have to worry about that, and my parents are coming in, but I think one thing I was concerned about is that I'm just a little worried about postpartum depression because one of my friends had it, and I'm just a little worried about that.
All right, it's okay to have mixed emotions about going home. It's completely normal. I'm glad to hear that you have a great support system to help you. There is a difference between baby blues and postpartum depression. We can go over that in detail, and then I want your partner to be aware of those signs and symptoms as well. If you feel like you start to lose interest in things, and if you stop caring for your newborn, then I want you to notify your provider. And some sense of sadness is normal in the first 2 weeks of delivery, so don't be too hard on yourself, okay?
Yeah.
Well, it sounds like you've done a ton of research, which is awesome, and that you have a great support system. Are there any questions that you have?
Not about anything we talked about yet, but I do have some questions about lactation.
Yeah, absolutely. I can go find the lactation nurse, and I'll be right back, okay? Hi, Audrey.
Hi.
So our lactation consultant is a little wrapped up at the moment, but
Okay.
she'll be here later on. My nursing student is very well versed in lactation, though, so I would love for her to speak to you. Okay?
Yeah, I can try to answer any questions you have. Your milk should come in more heavily in the next few days, and it's not abnormal for your little one to only eat a little bit in the first few days of life since their stomach is still pretty small. I can also get you some information about the period of purple cry, which can be really helpful for the first time parents who are worried about how much their little one will be crying. But for now, just try to sleep when your baby sleeps.
Okay, yeah, I think I'll definitely want those resources, and I don't think I have any other questions.
Okay. Yeah, perfect. And I think we still kind of want to do a follow-up postpartum blood draw before you leave. And I think you'll also be due for the MMR vaccine if you'd like to get that since you weren't able to get it during your pregnancy. But other than that, we can continue to move towards discharge.
Postpartum can be an overwhelming, exciting, and intense time for any parent, regardless of how many times they've been through it. Your care team's role is to prepare you to be successful after discharge and to make sure you have everything you need to do so. Active participation in your care can help this process to be smooth and easy.